Placental insufficiency can have serious consequences for a baby, including leading to a brain injury like hypoxic ischemic encephalopathy or HIE at birth. But what exactly is placental insufficiency, and how do doctors and defense lawyers use this condition to explain HIE in medical legal cases? In this video, we're going to break down what you need to know about placental insufficiency and how it can impact your baby's health, especially when dealing with an HIE brain injury. Hello, I'm Marcus Boston. I'm a birth injury lawyer, and I help families whose babies have suffered HIE brain injuries at birth. Today, we're going to talk about an important issue, and that is placental insufficiency. You might have heard about this term from either doctors, or maybe it was brought up during a legal discussion that you had when you were exploring your baby's HIE brain injury. Let's get right to it. So, placental insufficiency. This happens when the placenta, which is responsible for delivering oxygen and other nutrients to a baby during pregnancy, isn't functioning properly. This can lead to your baby being deprived of oxygen, which puts their brain at risk for an HIE brain injury. Some common causes of placental insufficiency include things like maternal conditions like high blood pressure or diabetes or other types of placental abnormalities like a placental abruption. In cases of severe placental insufficiency, the lack of oxygen to the baby can result in an HIE brain injury, especially if medical professionals fail to act quickly during labor and delivery. Now, this is where things can get more complicated, especially in legal cases. Defense lawyers, what they might try to argue is that placental insufficiency, not medical malpractice, is what has caused your baby's HIE brain injury. Oftentimes, what they'll do is they will claim that the injury was due to the placenta's inability to deliver oxygen to your baby well before labor and delivery began, essentially saying that the injury to the baby was inevitable. But here's the important part. One of the strongest tools that we have to combat this type of defense is the placental pathology report. I've talked about that in the past. This is where a pathologist examines the placenta after birth to look for signs of damage or other types of dysfunction. If the pathology report doesn't show evidence, though, of placental insufficiency, things like infarctions or abnormal blood vessels, this can significantly weaken the defense's argument that it was something that happened before labor and delivery. Without clear signs that the placenta was the root cause, the focus would then shift back to what happened during labor and delivery. Was there a failure to respond to fetal distress? Were there delays in performing a C-section? These are the types of questions that need to be thoroughly investigated when you are trying to understand from a medical legal standpoint whether your baby's HIE brain injury was due to medical malpractice. Again, I'm Marcus Boston, and if you have more questions about your baby's HIE brain injury from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me personally and how to contact me, my law firm, all of that type of stuff in my profile. All right, that's going to be it for today's quick educational video. Have a great day, everybody.